Weighing all options. We're going to talk about obesity. Let's speak up about obesity, our next session, weighing all options. Please welcome Dr. C. Nicole, also known as Dr. Courtney Whittle, a dedicated pediatrician, trailblazer in the industry of obesity medicine. She also serves on the American Board of Obesity Committees and is the founder of the Wait a Minute Clinic, a telehealth practice focused on treating obesity. Round of applause. Next up, we have Lauren Cassie Flowers. She is a registered dietitian and board certified as a diabetes care and education specialist. Round of applause for Lauren Cassie Flowers. And our moderator for this session is Corinne L. Corbett, an accomplished media professional and lifestyle expert who is also the editorial director of Black Health Matters. Round of applause. And after we give a hearty greeting to all these panelists, Dr. Contessa Metcalf will take over as our next co-host for the day. It has been a pleasure serving you.
Thank you. How's everybody doing today? Having a good time so far? I caught y'all moving. Y'all working it out there. All right, so today we're gonna speak up about obesity. And I'm really excited to have an honest conversation about this. So let's start off with, what are some of the obstacles to creating honest conversations between patients and their healthcare providers?
Well, hi everybody. Oh, a little loud. Oh, I love this. No one ever responds. So I'm a story type of person, and I've heard this story 1,000 times of someone who was maybe suffering from knee pain. They finally got so unmanageable, they finally made that doctor's appointment. They had to wait 2 months. They managed to get the time off of work. They went into the doctor's office. They had to sit and wait probably 30 minutes in those really uncomfortable chairs with that horrible TV going, but it's okay. They made it there. They finally get back. The nurse gets their weight, their blood pressure, and some other tests that don't really have anything to do with the knee, but it's okay because we made it today. They finally get to the doctor, and 15 minutes in, it's lose 20 pounds, I'll see you in 3 months, and then we'll talk about the knee issue. That is what we call weight bias and weight stigma. They're not really focusing on the problem itself, but just the weight, and that's not helpful, right? That's a huge boundary to getting you the care that you need.
So I think weight bias is definitely one of the hugest reasons why we have difficulty having honest conversations. I think another big reason is fear. I think a lot of times there is this big misconception about weight versus obesity versus beauty, right? Let's keep it all the way 100, right? How many of us have gone to the doctor or, heard someone kind of bring up our weight and been ready to take our earrings off, been ready to kind of fight because we're upset because somebody is insulted us, right? Like, we're here, we're at our doctor's office, and all of a sudden somebody has said, hey, I want to, kind of talk about the fact that, Mr. So-and-so, Mrs. So-and-so, you have obesity. And you're like, hold on, like, wait a second. We just met, okay? Hold on. I don't know if we know each other well enough for you to be calling me obese, right? Like these thighs I done had for a while, right? My husband likes them, okay? Right, so hold on, right? And so I think right, so now we ready to write a complaint, right? We're not coming back, right? So now we tune them out and we've missed all of the things that they've now kind of continued, right? We're not listening about our cholesterol. We're not getting ready to hear about the blood pressure that they're getting ready to talk about because I'm offended. You just called me obese. I didn't come here for that, Okay? And on the flip side, right, the doctor who may have just met you for the first time is, kind of looking at a chart and looking at a BMI and said, I don't know this person. I've just met this, patient, and I am actually concerned, and I don't know if I can use this term or mention this, and I don't want to. And so I don't know if I'm going to address this elephant in the room because I don't want to create this, bad patient, relationship. So I actually am just gonna, hey, Mr. So-and-so, Mrs. So-and-so, okay, so today we're gonna talk about this cough. I'm gonna listen to your heart, okay? So next year I'll see you, and I'd like you to eat a little bit better, maybe exercise, see you, in a couple of months. And we've walked out the door and we've missed an opportunity to actually have that honest conversation. But unfortunately, right, because for so long obesity has been used in such a negative way, people don't say it, right? Weight, we don't say it, right? But obesity is different from weight, which is different from beauty, but we unfortunately confuse the three, right? And so we've missed that opportunity, and we only go to the doctor once a year, some of us less than that. Right? And so we've missed that opportunity to then address something that is very important and a real factor in our health.
These are great. I mean, the focus and this one works. So the answers are really great because we're talking about culture, how we see things, and how we react. So what are some of the issues that contribute to challenges with weight? Like, what are the issues that we're facing?
I think, again, some of the challenges that we face with weight. I don't know, because it worked before. So I think one of the, again, the issues that we face with weight is first a fear of just addressing it, a fear of understanding that it is a problem in our community, and it is an ongoing problem, right? It's a problem that my grandmother had, and then my mother had, and then I have. And, this problem that is not due to us having big bones, is not due to, we just all kind of look like this. And, it just is, that's just how my family is. You know what I'm saying? So just leave us alone. That's not true. And just because my grandmother had diabetes and my mother had diabetes, I don't have to have diabetes. And there are things that we can do differently, and we can actually ask questions, and we can eat differently. And I think that that's a problem. I think, unfortunately, in certain areas, there are lots of fast food restaurants on this corner, that corner, that corner, and this corner. But that actually is okay. We just can choose certain foods at that fast food restaurant. So we don't have to feel like we're defeated or that all is lost. We just have to make the best of this situation. But we have to make sure that we're working with doctors who maybe understand our circumstances. We have to make sure that we're comfortable asking the questions and say, okay, listen, this is my family history. I don't want to go down this road. What can I do differently? And then when they tell us what we can do differently, we gotta do it differently. And if we are not ready to do it differently completely, we gotta be honest and say, okay, I heard what you said. You said do these 5 things. Okay, I'm not gonna do all 5 of them. That's okay. But I'm ready to do 2 of them. So which 2 do you think is most important to do right now? And when can I come back to discuss my progress and which one I can do next? And I think making the time, instead of coming to the doctor once a year or every 15 months, to then maybe come more frequently, right? And making your health that priority, because if it's not a priority to you, I can promise it's not going to be a priority to that doctor, right? So we've got to make ourselves that priority.
That was great. Just to add a few things, I actually had to take some notes because there are so many barriers to weight management, and I always like to tell my patients, I would have gotten a lot more sleep in grad school if I didn't have to take biochemistry, if weight loss was just calories in, calories out, right? So there's so many components. There's the genetic components. Some of us have more fat accumulation compared to someone else who may develop muscle mass more regularly. There's a behavioral connection to it, right? Some foods are actually made to increase our appetite and to increase our hunger. We don't know that. We just see the bright, colorful advertisement and we see, oh, it has like 18 grams of whole grains in here. That might be a good choice. We don't see the 26 grams of sugar that's also in there, right? There's an environmental component to it as well. Do you feel safe going out and taking a walk in your neighborhood? Do you have a park nearby that has equipment that you can use for free? Or are you gonna have to cash out an extra $99 a month to go to the gym, right? So that's a huge factor as well. And then medically, some of the medications that we prescribe, not me because I'm a dietitian, nutrition only, but some of the medications we can prescribe can lead to weight gain. A lot of us don't know that. So having that discussion with your doctor about weight neutral medications as well can be a really important part of your weight loss success.
We're just going to be passing the mic during this session. Pass the mic, DJ Cassidy. How does weight management, how does weight in general impact other health issues?
I'm a nerd, so excuse my statistics. I recently read a study that someone that is struggling with obesity has 30% more or an increase in mortality. Unfortunately, if you gain a lot of your weight in your stomach area, that increases your risk for metabolic disease. That could impact over 50 weight-related comorbidities from all the way to your head to your feet, right?
Tell them what a comorbidity is.
Oh yeah, so the weight-related comorbidities, that's hypertension, type 2 diabetes, thyroid disease, 18 different types of cancer. Psychologically, it could increase your anxiety as well as your depression. It can disrupt your gut microbiome and cause issues with acid reflux, diverticulitis, diverticulosis. And so these are all things that we are paying attention to. And so if you do go to your provider and they're just talking about weight and they're not doing a deeper dive in all those other metabolic related issues, possibly time to find another doctor, possibly time to just start asking more questions because weight does have an impact on our overall health.
I think she stole a little bit of my thunder, but no. I was going to say that I think a lot of us, are aware or at least have been told that, obesity, causes the diabetes and the high blood pressure. But, some of the lesser known, things is that obesity has, a root or a cause from head to toe. So, there are certain types of headaches that are caused by and worsened by obesity. Like you mentioned, several different cancers that are caused or increased risk by obesity, liver disease, kidney disease, cataracts, glaucoma. For women, you're looking at infertility. For a lot of us, we assume, right, and I'm just going to keep it 100, right? So when we laugh, sneeze, gotta pee, and we gotta run to the restroom, a lot of us will chalk that up to, well, I've had babies. But the answer is nope, that is not true. It is an increased by obesity. But on the flip side, if you lose 5% of your total body weight, that goes away. So while we're in the grocery store and spending dollars and dollars and dollars on those pads and those underwear, you do not have to do that. You can treat that and resolve those symptoms. For women who have irregular periods or difficulty getting pregnant, these things are improved by improving obesity. There are men low testosterone, difficulty in the bedroom. There are a lot of things that are, right? We chuckling, but these are conversations, okay? You go into the doctor, but we're having conversations. It's affecting the marriage. Right? These are things that are worsened by obesity, right? But so a lot of our health, the root cause is obesity. So you treat that, you improve your overall health.
So this is about speak up about weight, right? So what are the kind of solutions that we need to discuss with our primary care provider that can assist us with weight management that may not be initially offered?
We usually try to tackle it in a tier system based off if you do have one of those weight-related comorbidities that we spoke about before. But I will say my specialty is in bariatric surgery, and so I have to get everyone's weight and diet history as they're starting that process, right? So one of my first questions is, well, when did you start actively trying to lose weight, and did you have guidance by a doctor or a dietitian? How many people do you think say, yes, I worked on it with my doctor? Not a whole lot, right? Some, none at all, which is scary to think about. So if you're feeling like you're generally healthy, you're not taking any medication, your labs are going great, you just may want to lose 5 or 10 pounds, we're just going to talk about lifestyle intervention. And lifestyle intervention is not, hey, here, try this keto diet, right? Lifestyle intervention is what are you doing on a day-to-day basis? What are your meals you're preparing, and what small tweaks we can make there? If you do have to lose more than 15 or 20% of your excess body weight, and you do have one of those weight-related comorbidities, then we may escalate it and talk about lifestyle medication or lifestyle plus medication, if that's appropriate at that time. And then if you have all of the above, your BMI, you've had more than 7 or 8 diet attempts, your weight doesn't seem to be really going anywhere, then we may escalate even further and talk about bariatric surgery. But does anybody happen to know, I'm sorry, I like to ask questions, does anyone happen to know what happens to your metabolism over time if you've had a lot of weight loss attempts or diet attempts? It slows down. I see you raising your hand, Dr. Ivy, you're not allowed to answer. Yeah, so over time we're losing that muscle mass. So if you see a plan that tells you, hey, you can lose 10 pounds in 2 weeks, absolutely not, because some of that's gonna come from your muscle. The more muscle we lose, the slower metabolism is, and it gets harder and harder to maintain that weight loss. So you definitely wanna take that tier step and make sure you're not losing too fast either.
Yeah, so the hard part about your primary care doctors is even the ones with the best intentions, time is always a limiting factor. And that's just because, again, they see you once a year, and a lot of us come in, because we're coming in once a year with a laundry list of concerns. And so if your weight or obesity is one of those concerns, it's very challenging to dedicate a lot of time during that appointment time and also address your cough, your acid reflux, your headaches, your knee pain, and everything else during that visit. So one thing you can do with your primary care doctor is schedule a separate appointment to discuss that outside of your annual physical, so that you can just devote that appointment time to discussing. Another thing is schedule an appointment with an obesity medicine doctor. There are a lot of us out there that where all we do is during that appointment is discuss obesity, which means we discuss what you're eating, the medications you're taking, and we're not doing or dividing up time discussing anything else. Most of the time you don't need a referral to do that. It's covered by your insurance, and that way you can have those questions addressed. Same with scheduling an appointment with a nutritionist, so that way you can have that time devoted to getting those questions answered. If you feel like your primary doctor is not hearing you, ask for a referral, but again, you can do it a lot of times without a referral or going through your primary doctor.
So I'm going to just ask a follow-up question to Casey. What is an alternative if you have a doctor who's low on time?
So the benefit of being a dietitian is I have 60 minutes as for new patients and I have 30 minutes for follow-ups. I can't prescribe medication, thank God, because I don't want that stress. But I can talk to you about what your schedule looks like. Do you work days? Do you work nights? If you don't have the ability to prepare meals often, what alternatives do you have? So I think having that referral to a dietitian is really beneficial, and then finding a provider that has a program. Do they have support groups? If they don't, do they have like an active social media page where you can communicate with other people going through this? So the last thing I'll add, I promise I hand it back. Another stat, but a paper just came out that said 4 out of 5 Black women are struggling with overweight or obesity, yet we all feel so alone while we're trying to tackle this issue, right? We do not have to be alone. I think when it comes to weight management, community is the best way to go.
I couldn't agree more. A couple of follow-ups that are weight. We started talking about weight cycling, but I want to talk a little bit more about the impact, the overall impact of weight cycling, i.e. yo-yo dieting. We've all done it, right? We've all tried whatever, the cabbage soup, the master cleanse, whatever's hot at the moment, we've tried it, right? Slim fast, for those of them people who've been around a little while, right? So we talked about the impact on metabolism, but what other impact does weight cycling, how does that impact us?
I think the biggest impact it has is on your self-esteem. So one of the biggest misconceptions about weight and obesity is that it is a very simple equation, that weight is just related to what you're eating and how much you're exercising. And I think that misconception comes, and we get it everywhere, right? You see it in magazines, you hear it on like every media, and even you get it when you go to the doctor, right? So the doctor sees you and says, hey, I'm concerned about your weight, so I want you to go exercise, go outside, walk a little, and I want you to change your diet, and then I'll see you back in a year, go. And so you go and you exercise, and that's a me thing. And then you change your diet, and that's a me thing. And you like maybe even go hard. Like I'm about to go to the gym, I'm about to get a trainer, right? Like I'm doing all the things. And then I'm gonna get it, like I'm about to really do this stupid diet. Like I'm about to like get on this cabbage thing. And like while all my friends are out, like doing all of the brunches, and I'm sitting here like, nah, girl, I don't want no mimosa. Like I'm drinking my cabbage juice, right? And then on a Saturday, I get up and I'm peeing and I'm getting naked and I'm gonna get on the scale, I'm gonna close my eyes, say a little prayer, because I know I did this, so my scale is gonna change. So then I like suck it in, and then like me and God had a whole little thing. And so then I get on there, right? And so it's supposed to be less, right? Because I followed the instructions, because somebody told me I'm supposed to exercise and I'm supposed to change my diet, right? And then I look down. It ain't no change. Or it's even worse, it went up, right? So now I'm mad, right? Because everybody else was at brunch doing their thing, right? So, right, like something went wrong. So now I'm like, well, I don't understand. But that's because the equation was wrong. Like weight is more than just diet and exercise. For some, it was medications. And if I'm on a weight gaining medication, I can exercise all I want. But if I'm taking this medication every single day, all the exercise that I'm doing, the weight's coming right back. So now I'm really, really annoyed, and I don't know, I might even be throwing this scale up against the wall because I'm exercising every day and I'm not drinking my mimosas, and I'm just like, I don't know what to do, right? So now, right, like, it's disheartening, like nothing, especially to a Black woman who is used to like getting results. Like I used to being able to handle everything, right? Right, and then like it's really messing with me, right? I'm taking a medicine, but I don't know that because like I'm not supposed to know that. I didn't go into this field. right? Or I have this gene from this mom and grandmother, and I didn't ask for that, right? I didn't tell you, hey, give me this gene to make me gain weight, right? I don't know that. Or I didn't know that I was born via a C-section, and C-sections actually predispose to childhood obesity that predisposes to adult, right? I taught you something today. Look at that. See? But listen, I'm an obesity medicine physician. I know this, right? See? So these things are part of your weight story, but you don't know this because somebody just told you all you got to do is diet and exercise, right? But so that's part of the yo-yo, right? Because you're doing a cabbage diet. So now you're thinking you're going to lose weight. So, and maybe you did because you're drinking just cabbage, but then when you stop, the weight comes back, and then, but so these are things that like never work. But if you're working with someone who sees the entire picture and figures out all of the things that are contributing to your weight story and figures out how to address all of the things together, then when you get on the scale, I actually see a difference. And I didn't have to drink cabbage to do it, right? And so now I can do it with confidence and I don't have to worry about the yo-yo.
Okay, so we decide that we want to work with a specialist, right? Let's talk about insurance. Because we got the best intentions. We know we got to use, we want to see somebody, but can we afford it? And does our insurance cover it? How do we find out?
That can be such a difficult question to answer, and my biggest thing is always be your own biggest advocate and reach out to your insurance directly, because I may have Cigna, you may have Cigna, but Cigna covers her, but it won't cover me because I work someplace different, you know? So it can get very complicated and very confusing. So doctor's visits are always free, or not free. Doctor's visits are normally covered, I wish. Doctor's visits are normally covered, maybe not the specialist, but that doctor may be able to refer you to a community program. You know, there's like the diabetes prevention programs at the Y. There's some insurance companies have their own program where they'll send you an app and have someone call and check in on you each week. You know, so there's other options. We ideally, top tier, want you to see a specialist, but there's other options if you're not able to do that.
All of what she said. So, but that, and so, you know, your insurance is your first step, and then with specialists, working with someone, a lot of times the visits, there's ways to get that covered. Then the next question is there ways to get medications covered? And the short and quick answer is, not every medication is going to get covered by your insurance, and that's going to be, you know, actually based on your employer. But there's lots of options if medication is the best route for you. But I think being open to trusting your doctor to find the best fit and the best cost, because there's a variety of options. And sometimes what is the best medication may not be the option. Sometimes it's just what is the best medication that's right for your pocket. And sometimes we just go with that, and that works too. And that it is what it is.
Okay, so we know what we need to do, but then we go to the doctor and we don't know what to say. Or we feel like we're being dismissed. So can you give us some examples of what to say when we feel like we're being dismissed? When we go in, we've come from this seminar, this great discussion, I'm gonna go talk to my doctor, and you go in and then they say, lose 20 pounds, come back next year. So what are we supposed to say?
My job's probably going to beat me up for this because I work for Morehouse School of Medicine, but I work with med students, residents, and then attendings. And, you know, have you ever met someone that's like really, really smart in one thing, but they have like no people skills sometimes? I love the students, I love the residents and the attendings, but sometimes they're not so great with the people skills. So I always say come into your visits prepared, have your questions, but if they are not acknowledging your questions, ask them to document the concerns in your chart. If you're having an issue or if you ask for a certain test and they denied you that, ask them to record that in your chart for them or for you to look at later. And then also, if you have a specialist like a dietitian, I know how to talk to those guys a little bit. So sometimes I've been the buffer in between. Like, okay, I'll go talk to your doctor for you and let them know your concerns because you've tried to bring this up a few times. But I'm going to let the physician take over and see what she says about it.
My philosophy is life is short, and it's really hard to teach an old dog new tricks, meaning trying to get someone with bad people skills and teach them how to be better at that, like it's a waste of your time. So I just feel like if someone you're not vibing with them, it's a whole lot easier on your just energy, spirit, to just find somebody else rather than trying to teach them how to be better to you. Like, just thank you. I appreciate it. Absolutely. To the next one.
Because obviously there's great doctors out there.
And knowing that you can switch doctors is a real thing.
So for those who didn't hear, Dr. C. Nicole said, knowing that you can switch. So you have the power to switch. You don't have to stay with somebody who's mistreating you. So this has been, have you guys enjoyed this discussion? We decided to go a little longer and not do a Q&A in this instance. Dr. C. Nicole has a table outside if you want to go talk to her afterwards. I'm sure Casey will talk to you afterwards, but I'm going to ask the final question. How should we measure success beyond the scale?
This is my absolute favorite question. So each Friday on our Facebook group page, we were doing face-to-face Friday, but some people weren't hitting their goals as quickly as they wanted to, so it was kind of sad for them, so we changed it to non-scale related victory Friday. So here are my favorite 3, and I want everyone to think of like what their favorite non-scale related victory is. So one is I was able to play with my kids or my grandkids for 30 minutes straight without having to take a break. I was able to walk from my car to the grocery store and I didn't run out of breath one time. And I was able to get on the airplane and I just put my hand up because I didn't need my seatbelt extender this time. So there's tons of great non-scale related victories out there, and it's very important to always have grace with yourself and remember it's not the number on the scale, it's definitely how you feel.
Some other ones, because obesity causes so many other diseases, is, I was pre-diabetic and I'm no longer. I was on 2 antihypertensive medications. Now I'm on 1 or none. I was on metformin. I'm not anymore because I wasn't taking it. There it is. Or for some people, the scale doesn't change, but I was in this size for clothes, and I'm now wearing a smaller size, So
I just want to say to Dr. C. Nicole and L. Casey Flowers, thank you for your time. I know I learned a few things, did you? Thank you.